everyone, it's Nurse Ange-Aimee. Today we're going to be talking about recertifications, ROCs, resumption of cares, and follow-up visits. So you completed your SOC, you turned in your paperwork to the case manager, you said whether or not you recommended physical therapy, how many nursing follow-up visits a week you recommend, things along those lines. Now what do? Well, typically the office already has a LVN to follow up weekly, and they already work on the scheduling for the physical therapist or whatever else you recommended. So unless they don't have another follow-up nurse in the area, you won't complete your next visit until either the recertification or the resumption of care. So first, we're going to talk about the recertification visit. So this visit typically happens every 60 days. So during this visit, you want to determine if the patient has an ongoing need for home health services. So basically, you're going to determine ongoing eligibility, evaluate continued skilled nursing, and update the plan of care. So you're going to complete a full body assessment, medication reconciliation, evaluate the progress of the patient, determine continued homebound status, assess caregiver support, and update ANS. Make sure they don't have any expired medications. Make sure they're educated on which medications they're supposed to be taking. Make sure they have been taking the medications. Before this visit, you want to review your start of care again, review the LVN notes possibly if you're able to, and then get an understanding of what has been going on for those past 60 days. Determine if they still need physical therapy. Each of these visits, anytime you're at the patient's home, you want to identify any safety risks. For example, if the patient is supposed to be using a walker and you notice they're not using it, that's a safety risk. Or if there's a rug in the living room or cords that should be removed, that's a safety risk. If the patient's on oxygen and there's smoking materials around, these are all of the things that you want to make sure that you're covering during this visit. So it's pretty similar to the start of care. You're just determining whether or not the patient is going to continue with these services. Now, if the patient was hospitalized during their home health care for any reason, which means they go to the ER and then they do end up becoming admitted, this is what would be called a resumption of care. So of course there's really not a time on this, it's simply if the patient was hospitalized. So the resumption of care, before you do the visit, the most important thing you want to do is to get the discharge paperwork and determine why the patient was hospitalized. And thoroughly read over everything so that you're prepared for the visit and that you could further educate the patient, because while the patient's hospitalized and when they're discharged, they might not have understood all of the education or they might have not been in the right mindset to fully understand everything. So you want to be the one to read over everything so you could properly educate the patient. So an example would be if the patient was discharged home with antibiotics. One, you want to make sure that the patient received the antibiotics and they understand the order for the antibiotics, and that they know that they need to complete the antibiotic therapy. So that's just one example. So ROC, you want to know why they were hospitalized, what treatments were done, medication changes, or any new diagnosis. Again, during these visits, you want to look over their medications again, determine if anything's expired or if there's any medication discrepancies at all. Another thing you want to do during both of these visits and every time you see the patient is you want to make sure they don't have any new wounds or skin changes or any condition changes at all. So an example, if a patient's diabetic, you want to check their feet during the visits because they might have a new wound that they're unaware of. So these are very important. The RN does not want to miss these things because you want to make sure the follow-up nurses are fully prepared for everything. And you want to remember too that the goal of home health in general is you want to prevent hospitalizations. You want to make sure that the patient is understanding which medications to take. You want to make sure that their blood pressure is stable. If their blood pressure is not stable, do we need to talk to their primary care physician about possibly changing their hypertension medications, things along those lines. These visits, you want to make sure your charting is accurate. You want to make sure that it's following the guidelines. You want to make sure that everything is updated. If a medication was discontinued, you need to put that. If a new medication was started, you need to add that. If there's a new wound, you need to, take a picture of the wound, things along those lines. These I will further explain in another video. But I hope that answered all your questions about follow-up videos. And thank you so much. Please subscribe. I'm going to be working on many new videos, so any feedback or questions are welcome. And I will see you guys later. Bye.